Welcome, everyone. I am Maureen Harrington. I go by the pronouns she, her, and I am on Ohlone land here in Richmond, California. Um, Welcome to the NorCal Somatic Experiencing Professional Association. This is the Mark Schuler series that has been funded by our late colleague Mark Schuler from his estate. Um, just to let you know a little bit about us, NorCal SEPA is a professional association that supports SEPs in the Northern California region to have impact, to be able to network, and to step into leadership roles. We'll have another event. An upcoming event is on December 5th at 12 noon. And that is called Working with Complex PTSD, Developmental Wounds in Individual Therapy and Other Bay Area, with a Bay Area luminary named Christine Donahue. So I also want to invite you to join NorCal SEPA, considering serving on our board or committees, and to help us lead the way for our large SE community in Northern California. This is our third speaker event, and we are so grateful to have such a talented and impactful SE leader with us today. We are grateful to have Sharlisa Byrd help us embody SE and support our practices in our community. She brings tremendous depth and skill to our community. And with that, I'll pass to Mike to introduce Sharlisa.
I feel really grateful. One of the best things about running a speaker event is you get to meet such talented and wonderful people. And so I feel very grateful to have gotten to connect with Sharlisa. I know please watch her space, because there is stuff that's going to be coming out of her that will really uplift our community in many ways. She's a leader in the SC community. She trained under Resma Manicum's somatic abolition, as well as in the various other trauma resolution modalities. She served clients and students and colleagues in many areas. Her life and training and clinical experience have shown how trauma, anxiety, and depression can get stuck in our bodies. She's also an adjunct professor at SFU, where she teaches cross-cultural counseling, substance abuse, addiction counseling, adult development, psychopathology, child and adolescent counseling, assessment, and trauma and crisis work. She is working on several books, one of which will focus on embodied somatic tools for addressing the human toll of intergenerational trauma. She has served clients in so many important areas and brings this expertise to the work. Some of these are domestic violence shelters, schools, community mental health, and private practice, and in custody services. We are really grateful to have Sharlisa to share her time, talent, and insight with us. And without any further ado, I'm going to pass over to you, Sharlisa.
Hello, everyone, and welcome. It is an honor to be in all of your presence. And I want to just start with allowing us to just take a moment so that we can get grounded. Simply allowing ourselves to just come into this time and space together. Allowing ourselves to just take a deep breath and pause. See, in our modern day world, as we find ourselves, we're constantly being caught up within our mind. We often lack a full sense of being grounded. But when we're grounded, we are deeply present with our body, with the breath and the world around and within us. The mind is at greater ease, and we move through the day with greater presence. The good news is that when we are feeling ungrounded, a simple grounding exercise can bring us back into the earth and into our bodies. So I invite you to join me, just allowing ourselves to get grounded. So I invite you to come into a comfortable seated position, ensuring that your spine is straight, the shoulders are relaxed. And I invite you, if you're comfortable, only if you're comfortable, close your eyes. And if not, find a focal point. Taking 5 full deep breaths. Slowly and steadily. And as you find yourself drop deeper into this present moment, and as you breathe, let the belly be soft to encourage the breath to flow as deep as it's comfortable for you. And after these 5 grounding breaths, shift your intention to the earth beneath you. Depending on how you're seated, tune into whatever physical reality supports you. Hold your attention on the areas of your body that are in direct contact with what is breathing in you. Stay present with this for 10 full breaths. Simply notice. That's it. And gently shift your attention to hold the fullness of your body in your awareness. And simply notice what it feels like to be in your physical body right now. What is breathing in you? Stay present with this. Observe whatever sensations might be here. Allowing yourself to come back to the breath for another minute of mindful breathing. Remain attuned to the sensations of every breath. Allowing yourself to come back to the breath for another minute of mindful breathing. And when you're ready, remain attuned to the sensations only when you're ready. Allow yourself to transition back to me, feeling more grounded and present. And when you're ready, only when you're ready. Allow yourself to transition back to feeling more grounded and present.
Sharlisa, I don't think we can hear you. Sorry to speak so loudly in the room. Can others hear her?
Can you hear me now? Okay, I'm not sure what happened. Okay, I think we're ready to begin. So let's go ahead and get started. So in today's rapidly changing world, trauma has uncomfortably become an ever-present experience for many, whether it's stemming from adverse childhood events, sexual abuse, accidents, natural disasters, or other distressing events. Trauma's profound effects reach deep into the fabric of our psychological and physiological well-being. Recognizing and addressing trauma has been more crucial given its profound impact on our daily lives, relationships, and overall mental health and physical health. When we speak trauma, it's not just about triggering events, but it's the body's response to these events. Our bodies are wired for survival. And when confronted with traumatic events, they react to ways in which they can become ingrained, leaving lasting imprints long after the events have passed. These imprints can manifest as persistent feelings of fear, anxiety, and a host of other symptoms that can prevent an individual from leading a normal, healthy, fulfilled life. And this is where therapeutic interventions such as somatic experiencing and exposure therapy come into play. So both therapies aim to address trauma at its core, helping individuals control and process and ultimately move past their traumatic experiences. Through a combined understanding of the body's reaction, guided techniques, and controlled exposure, these methods, they offer a pathway to healing, growth, and peace. And that's what we all want. So what we're going to do today, we're going to dive into the principles and approaches of both somatic experiencing and exposure therapy. And by understanding how it works, then you'll benefit on how it can be applied, how we can shed some light on the transformation of power that these therapies and their potential change and how it can affect your life, that healing, that medicine that already lives within us. So the significance of this topic extends beyond just individual directly affected by trauma. This also is connected to your friends, your family members, colleagues, community members, and understanding that trauma and its healing can foster empathy, creative, supportive environments, and empower us to be agents of change. And that's what we all want to do. So what we're going to do is dive deeper into trauma. So trauma, no matter how it presents, it creates, whether it's challenging childhood experiences, unforeseen accidents, natural disasters, war, it can deeply embody itself within our physical symptoms. It influences every facet of our lives. It affects us. It is essential to understand that trauma happens within our nervous system. It's not the event. It happens within our body. At the core of our biological design is an instinctive drive for survival. Our body is meant to survive. This drive prompts our bodies to react during traumatic events, but these reactions can linger, even becoming habitual. The remnants of trauma can surface as feelings of distress, anxiety, disassociation, and many other symptoms. So recognizing the profound and pervasive nature of trauma can assist us in the way we navigate and the way we heal from its impact. So today we're going to focus on two transformative therapeutic approaches that have gained prominence in recent years. One, somatic experiencing, we're going to bring it to our body. We did a little of that this morning with the orientating, and exposure therapy. Both somatic experiencing and exposure therapy, they both are targeted approach to healing trauma. Somatic experiencing places an emphasis on understanding and releasing the physical tensions that manifest post-trauma, and exposure therapy focuses on controlled and gradual exposure to the traumatic events, allowing the individual to process and overcome the psychological effects. While there's a distinction in both methodologies, both of the therapies converge on the goal of helping to confront and process trauma, aiming for a holistic and a holistic healing and renewal. And that's what we want. To allow ourselves to just become one and make that process of healing possible. So our journey today, it's going to allow us to unpack the complexities of both of these theories, by shedding light on their foundations, the applications, and the profound healing that they can create. Whether you are a therapist or someone who has experienced trauma, or simply an individual eager to learn and understand, we're on this journey together. We're going to explore so we can provide valuable insight into these transformative modalities. So let's get started, and I invite you all to join me on this journey. So now we're going to transition to the autonomic nervous system. See, this plays a crucial role in the trauma response and recovery. It is responsible for regulating your body's physiological responses to stress, threat, and your traumatic experiences. It is in charge of everything your body does, whether you're aware of it or not. It happens and we don't even know it's happening. It regulates your blood pressure, your breathing rate. It controls your internal body processes, your heart, your blood sugar, your blood vessels, lungs, your digestive system, your body temperature, and a lot more. In understanding your autonomic nervous system, I'll refer to it as your ANS. Its role is essential for comprehending how trauma impacts the body, your mind, and how it affects the treatment strategies that we'll use. So let's paint this picture. During a traumatic event, the somatic part of your autonomic nervous system, it becomes activated. It means something starts to happen. You feel this happening. Your somatic nervous system, or SNS, is your component of your ANS, your autonomic nervous system, that activates the fight or flight response. And this leads to a surge in your physiological processes, such as increased heart rate, heightened alertness, the release of stress hormones like adrenaline and cortisol. These changes prepare your body to receive the threat. See, this is where the problem happens. The problem occurs when trauma is not processed and resolved. It gets stuck, if that makes sense. Your ANS may become dysregulated, and many people with a history of trauma experience chronic sympathetic dominance, which can manifest as symptoms such as hypervigilance, anxiety, flashbacks, and these persistent states of arousal can lead to various physical and physiological issues. Other words, to make it simple, we're feeling horrible. In trauma recovery, the autonomic nervous system play a role is twofold. One, it helps us to understand the physiological responses to trauma and how these responses are linked to the symptom. And two, it offers a pathway to healing and recovery. And that's what we want. Therapeutic approaches like somatic experience and exposure therapy, they target the ANS regulation to promote symptom reduction and emotional processing. Just saying that I feel my system just regulating. I feel that in my body. So I invite you, as we're going through this, simply notice what your body is experiencing. And by addressing your autonomic nervous system's role in trauma response and recovery, therapists and individuals can work toward reestablishing physiological and emotional balance, in turn contributing to improved well-being and enhanced capacity to confront and heal from trauma. Sounds amazing. So let's look at trauma. What is trauma? Trauma is a complex concept that refers to distressing events or series of events that have a significant and lasting impact on your physical, emotional, psychological well-being. Suffering. Trauma originates as a response in your nervous system. It's not the event. It happens in your body. It can be experienced physical trauma, emotional trauma, psychological trauma. And as you can see, the slides go into a little more detail on how that looks. If you want to take a screenshot of that. In all forms of trauma, the impact can be both immediate and enduring. Trauma can lead to a range of physical, emotional, and psychological experiences and symptoms, including but not limited to flashbacks, nightmares, anxiety, depression, avoidance, hypervigilance, sleep disturbances, loss of concentration, anger, and fear. Simply notice what's happening to your body right now. Treatment for trauma often involves therapy and support to help individuals process these experiences, developing coping skills and working towards healing and recovery. So different theoretical approaches, including somatic experiencing and exposure therapy, can effectively address trauma and its symptoms. And that's what we're going to look for. So trauma can significantly affect your autonomic nervous system and its regulation of that fight, flight, or freeze responses. This is also known as your stress response. So your autonomic nervous system is responsible for controlling many involuntary body functions. So these happens naturally. I absolutely love the brain. I want you to think of it like we're computers and how it processes information. Trauma can lead to dysregulation in your autonomic nervous system, resulting in altered responses to stress. And here's how trauma can impact your autonomic nervous system. It creates a heightened sympathetic activity. Your sympathetic nervous system is responsible for the fight and flight response, which prepares your body to deal with perceived threat. It can be real or perceived. In response to the trauma, your sympathetic nervous system can become overactive, causing heightened arousal and stress responses. And this is the result of the symptoms like the hypervigilance, the anxiety, and increased heart rate. Your body does it naturally. And I know we say, oh, this is horrible. Actually, we want to thank our body. It's a way of it's keeping us safe and protected. So sometimes we just have to tell our amygdala, thank you, but let's get some tools so we can acknowledge that we are safe. So we find it difficult to return to our baseline. After a stressful event, your parasympathetic nervous system is supposed to activate to calm the body and return it to a state of rest and recovery. We like that. Your parasympathetic nervous system acts like your brakes. I want you to imagine a car, and your parasympathetic nervous system is your brake. So when you're going too fast, your sympathetic nervous system reacts. Your brakes, your parasympathetic nervous system slows it down. So I want you to step on your parasympathetic nervous system. When you do that, you're able to get more control. The problem is, individuals who experience trauma struggle in down-regulating their stress responses. And this can lead to persistent feelings of anxiety, vigilance, and the inability to relax, which also can have that freeze response. Definitely can relate. I have that freeze response. Trauma can cause your autonomic nervous system to create that freeze response. This is an adaptive mechanism where the body becomes immobile in the face of threat. It's a survival tool in the short term. Remember, it only works for the short term. We don't want our bodies to get stuck in that freeze response. It's a survival tool. Yet individuals who experience frequent and prolonged trauma may become stuck in this freeze state. And this can manifest as disassociation, emotional numbing, feeling disconnected from one's body. Have you ever had that moment where, like, I don't feel anything? That's being stuck in that freeze response. Trauma survivors develop a state of hypervigilance, and where their ANS is constantly on alert, screening for potential threats. That heightened state of arousal can be exhausting. It takes so much energy, and it can contribute to symptoms like insomnia, become more irritable, and an inability to rest. And we need rest in order for us to function. Trauma can lead to our autonomic nervous system to become dysregulated. And when this happens, it fails to appropriately respond to our stressors. And prolonged ANS dysregulation due to trauma can contribute to various physical and mental health issues. It has been associated with conditions like chronic pain, gastrointestinal problems, cardiovascular issues, post-traumatic stress disorder, anxiety disorders. But understanding the impact of trauma on the autonomic nervous system is crucial in order for us to have trauma-informed care and therapy. So these therapeutic approaches like somatic experiencing and exposure therapy aim to help regulate the autonomic nervous system responses, facilitating healing and recovery from the effects of trauma. These therapies focus on restoring a sense of safety, helping individuals process the traumatic experience, ultimately promoting your autonomic nervous system balance and reducing the distressing symptoms associated with trauma. Just allowing yourself to notice what's happening in your body, just saying that. Just notice. The autonomic nervous system is a division of your nervous system's responses for regulating and controlling involuntary bodily function. It plays a fundamental role in maintaining that homeostasis, which is the body's ability to maintain a stable internal environment despite external changes and stressors that are happening around us. Your autonomic nervous system operates without us even knowing it. It happens automatically, controlling, once again, like I said, our heart rate, digestive system, respiratory rate, blood pressure. It can be divided into two main parts, what I have touched on a little bit, each having its own role. That was your sympathetic nervous system. That was our gas. This division is associated with the fight and flight response. When the body perceives a threat or experience stress, your sympathetic nervous system becomes activated. Let's look at some of the key features, including increased heart rate. You get dilated pupils, increased respiratory heart rate, breathing, redirection of your blood flows to your skeletal muscles. This prepares your body for emergency, even when it's perceived. Your stress hormones like adrenaline and cortisol are released during activation, enhancing the body to get ready for this threat. You feel it, it's happening. Your parasympathetic nervous system, on the other hand, is responsible for promoting rest and digest functions. When your body is at rest and not facing a threat, your parasympathetic nervous system becomes active and it decreases heart rate, constriction of your pupils, increased digestive activity, and relaxation of your muscles. These responses help conserve energy and promotes recovery. That's what we want. The autonomic nervous system operates as a delicate balance between the sympathetic and the parasympathetic nervous system. The body adjusts to the two systems to adapt to different situations. In a healthy individual, or where your baseline is, the autonomic nervous system ensures that the body can switch between fight and flight, fight and flight, and rest and digest as needed. This is what we want. This is our optimal way of functioning. But trauma, as we discussed earlier, it throws a wrench in everything. It can disrupt this balance and leads to dysregulation of the autonomic nervous system. So understanding the system is important in the context of trauma therapy because it provides insight into how body responds to stress and how therapeutic interventions like somatic experiencing and exposure therapy can help restore your equilibrium to the autonomic nervous system and promote recovery. And that's what we want, healing, so we can change, adapt, and grow. And it is possible. To thyself be true. The autonomic nervous system can be dysregulated by trauma, leading to a range of symptoms, like I went over again, anxiety, flashbacks, hypervigilance. And this dysregulation occurs due to the impact of trauma on the body's stress response system. So here's how the trauma triggers the body's fight or flight responses when it's primarily governed by the sympathetic division of your autonomic nervous system. So when a traumatic event occurs, this sympathetic nervous system becomes highly activated. It prepares your body to deal with the perceived threat. In a traumatic experience, the body might stay in a heightened state of symptomatic arousal for an extended period. And this chronic activation can lead to dysregulation of the autonomic nervous system, making it difficult for the body to just return to its normal state. Some people who are really suffering, who have complex trauma continuously, they stay in these states. And as a result, the autonomic nervous system dysregulation creates experience of hypervigilance. See, hypervigilance is a state of heightened alertness when a person is constantly scans the environment for potential triggers. It happens automatically. This can lead to increased anxiety and persistent sense of danger, even when there's no real danger present. This dysregulation of the autonomic nervous system can result in an overproduction of stress hormones, like I said, such as adrenaline and cortisol. This excessive stress hormones contributes to chronic anxiety. That's why I'm constantly going back to what's happening in your body. People who with trauma may experience generalized anxiety, panic attacks, or other anxiety disorder, OCD, flashbacks. Trauma survivors often experience vivid and distressing recollections of the traumatic event. Also, physical symptoms. Dysregulation of the system also manifests right there within your body, creating that heart rate, that muscle tension, headaches, gastrointestinal issues, and other stress-related physical complaints. They're real. When we're providing these services, we need to make sure we're connecting with what's happening in the body and the mind. These symptoms are often associated with that fight or flight response, problems returning to our baseline, and individuals with trauma have problems. May have problems from the heightened sympathetic state to the rest and digest state. It makes it challenging for them to relax, sleep, and recover from stress. It is possible for that healing process to happen. Approaches like somatic experiencing and exposure therapy aim to address this dysregulation of the autonomic nervous system. They help individuals regain control over their autonomic nervous system responses reestablish a sense of safety and process the traumatic memories or experiences, ultimately promoting healing and reducing symptoms. These therapies, they focus on restoring balance to the autonomic nervous system and helping individuals effectively cope with these experiences by creating strategies to manage their trauma symptoms. So let's take a look. Let's look at somatic experiencing. Love bringing it to the body. Simply notice what you're feeling right now in your body and invite it and welcome it. So somatic experiencing is a therapeutic approach developed by the amazing Peter Levine. He's a psychiatrist and an author known for his work with trauma healing. Somatic experiencing is body-orientated and somatic, meaning relating to your body. That's why I'm always saying, please notice what's happening. Its method is designed to address and resolve the effects of trauma on the body and the nervous system. It focuses on the interplay between your physical sensations, your emotions, and your nervous system. Your nervous system's responses to be direct and how it responds to traumatic experiences. SE is primarily used for healing and resolving trauma, which can result from various distressing experiences. Accidents, abuse, natural disasters, being in combat. It recognizes that trauma has become stuck in our body and our nervous system, leading to these ongoing systems in distress. SE places a strong emphasis on bodily sensations and awareness. It encourages individuals to simply notice, just notice, pay attention to your physical sensations and that felt sense of your body, allowing them to connect with and release that stored trauma. Let me explain something. So SE involves a gradual, gentle, and incremental approach to trauma resolution. The therapist and the client, we work together to explore and process the trauma in a manageable, small incremental, preventing overwhelming emotional and psychological reactions. Something called pendulation. See, this is the principle involving the natural oscillation between sensations related to safety and sensations associated with trauma and stress. See, SE holds individuals, help them develop the capacity to move back and forth between the states, gradually involving tolerance for traumatic material, which brings us to resources. See, resourcing involves identifying and cultivating internal and external resources that provides a sense of safety and support during the therapeutic process. These resources help individuals regulate their nervous system and facilitate healing, allowing the completion of the survival response. So we want to go through that, allowing that to be completed to resolve those experiences. So somatic experiences recognizes that during a traumatic event, individuals may be unable to complete that instinctual survival responses, like that fight or flight. These incomplete responses, they can lead to symptoms and distress. But with SE, it aims to facilitate the release of these held survival responses in a safe and controlled manner. Simply notice what's happening to your body as it shifts. The ultimate goal of SE is to help individuals integrate their traumatic experiences, restore balance to their nervous systems, and reduce distressing symptoms associated with the trauma. Somatic experiences requires specialized training. It has been found to be effective in helping individuals heal with the effects of trauma and regain a sense of well-being and resilience. Somatic experiences focuses on the body's sensations and on the concept of that felt sense to release trauma-related tension. It recognizes that the traumatic events, experiences can be stored in your body, leading to symptoms and distress. Here's an explanation of how SE uses body sensations and the felt sense to address trauma. So, SE places an emphasis on the developing awareness of the body. Your sensations, it encourages individuals to pay attention to the physical sensations, these experiences in the body. This includes tension, pain, relaxation, warmth, cold, various other body feelings. We want to include all of that in that felt sense. The felt sense is a central concept in somatic experiencing. It refers to the individual's internal awareness of their body sensations, their feelings and responses. This is subjective experiences, so it looks differently for everyone. And it varies. It combines sensations, emotions, and our thoughts. So before diving into traumatic experience and traumatic materials, SE begins by establishing a sense of safety and resourcing. Number one thing with dealing with trauma, you have to make sure you feel safe and stable. And we do that by creating resourcing. Resourcing involves identifying internal and external resources that can help the individual feel safe and grounded. Simply how we started today, allowing ourselves to come into our body. These resources can also be used to regulate the nervous system and provide support during the therapeutic process. Individuals are encouraged to explore their body sensations related to trauma, so in a controlled and titrated manner. This involves revisiting the physical experiences associated with traumatic events, which can include sensations like tightness, trembling, constriction, and more. So somatic experiencing explores the principle of pendulation and titration to ensure that the exploration of traumatic material is manageable and doesn't overwhelm the client's nervous system. Pendulation involves moving back and forth between sensations. Not just any sensations, but between the sensations related to safety and the sensations related to trauma. Imagine it like a dance, back and forth. Titration involves working with trauma in small, manageable increments, preventing re-trauma through titration. Somatic experiences acknowledges that during traumatic events, individuals may not be able to complete that instinctual survival response. So that's where we come in, to assist with this process. These incomplete responses can lead to stored tension and distress. So somatic experiencing helps individuals to complete these responses in a safe therapeutic setting. So as the individual explores and gradually processes the sensations associated with the trauma, the body releases stored tension and energy. That's that discharge. That's what we want. We want to let that be discharged out of our systems. This release is fundamental aspect of healing and somatic experiences, and often results in a sense of relief, relaxation, and resolution of the traumatic symptoms. SE recognizes the connection between the mind and the body, understanding that trauma is not only stored in our memories and our emotions, but it's stored in our body, right within ourselves. So by working with the felt sense, or as Resma said, our soul nerve, it aims to process and release the physical and emotional tension associated with traumatic experiences, restoring balance to the autonomic nervous system. SE employs various techniques and exercises to help process and release trauma-related tension and stress. So here's some examples. Tracking sensations, where individuals are guided to pay close attention to physical sensations, describe what, where, and how helps to increase the body's awareness and areas where there's stored tension. Orientating, that's something we did earlier this morning, where you just simply reestablishing a sense of safety, connect to the environment by simply grounding yourself and simply noticing what's happening around you. Pendulation, that's that moving back and forth between sensations. That's safety and that trauma. Safety and that trauma. Grounding exercises helps to feel connected to the present moment and grounded. Resourcing, identifying and cultivating internal and external resources for safety and support. I love bringing in all of our different identities as a body of culture. I love to bring our ancestors in to the room. How does that look? If right now I don't have the resources to do it, someone in my past, whether seen or not seen, that got the strength to allow that sacred space for me to enter here. Bringing that into the room can be resourcing. Completing that survival response. Allowing ourselves to be guided to complete that survival response that was interrupted. Simply pausing and acknowledging, what didn't I get to complete? What else needs to be done? What could you do? That car accident, could you have braced? Can we do that now? Just coming into your body to let that cycle be completed. Sensations, these exercises focuses on the connection between the physical sensations and the emotional sensations. Slow movement, somatic exercises, allowing that slow and deliberate movement may be used to help a client become aware of the body sensations. Stretching, yoga is amazing. Breathing techniques, allowing yourself to just slow and calm your nervous system so you can promote that relaxation that's needed. Safety and boundary work, establishing a sense of safety and personal boundaries is crucial in somatic experiencing. It is important to not do the exercises. They need to be conducted by someone who's trained, who can pay attention to what's happening within that body. SE helps in restoring and reducing trauma-related sensations by restoring the balance of that autonomic nervous system, reducing trauma-related symptoms through its body-orientated and trauma-focused approach. SE acknowledges the interconnection of the body and the mind. And by addressing trauma through the bodily sensations, emotions, and it helps to integrate experiences, promoting a sense of wholeness and reducing symptoms related to that disconnection and disassociation. SE aims at addressing the root of trauma. Let's say that again. It aims at addressing the root of trauma rather than just symptom management. And as our clients progress, they often experience longer lasting improvements in their autonomic nervous system, regulation, leading to a reduction in symptoms such as the anxiety, the hypervigilance, the flashbacks, and the physical tensions. So overall, somatic experiencing helps individuals to develop a greater resilience, self-regulation, and an increased capacity to process and heal from trauma. And isn't that our goal? We do this by simply restoring balance to your autonomic nervous system and promoting the release of stored tension. It can significantly reduce the trauma-related symptoms and enhance overall well-being. Yes, that is somatic experiencing. Notice simply what's happening to your body, allowing yourself to slow down and connect, which brings us to how does exposure therapy look? A little different. Exposure therapy is a therapeutic approach that involves gradually and systematically confronting trauma-related triggers in a controlled and therapeutic setting. Definitely, I want to reiterate the controlled setting part. It's primarily used to treat conditions such as PTSD, specific phobias, OCD, and anxiety disorders. The primary goal of exposure therapy is simply to help reduce their fears and anxiety responses to specific situations or stimuli associated with their traumatic or distressing experiences. Exposure therapy, or ET, involves the systematic and gradual exposure to trauma-related triggers. This means that the individual literally faces their fears in a structured and hierarchical manner, starting with less anxiety-provoking situations and progressing to a more challenging ones, kind of like a ladder. We want to start and work our way up. The exposure process is designed to safely reduce or eliminate feared stimuli by increasing acceptance of uncertainty, doubt, discomfort, disgust through habituation and or toleration. You want to create a sense of empowerment. ET can be conducted in three main ways: in vivo, using real-life exposures. We have imaginal, by conducting exposure in the imagination, tape scenarios, written or oral worst-case scenarios, and then also interoceptive, designed to help individuals have you sit with the feared stimuli that when you experience the somatic symptoms. With using exposure therapy, avoidance is a common response to trauma-related triggers. So we don't provide that reassurance. A little different from somatic experiencing. I'm going to show you, once we're done, how I found a way to support both of them through that integration process. So exposure therapy helps individuals confront these triggers and learn to resist avoidant behavior. It aims to facilitate the emotional processing and traumatic memories or distressing situations. How does it do that? Because it helps to confront and make sense of their emotional reactions and cognitive distortions related to their fears. ET is done in a safe and controlled environment with the guidance of a trained therapist. Please make sure they have been trained in exposure therapy. We want to establish trust, and a sense of safety is essential for the successful exposure work. Pretty much most work, you have to have that rapport and that safety connection built. In some cases, cognitive techniques are included alongside with the exposure. And we do this to help individuals reframe their thoughts and beliefs about the fears. They can lead to change in their emotional responses, and individuals are assigned homework between therapy sessions to practice what they've learned in session. We do not do any exposure for homework that you have not already did within session. That is very important. Exposure therapy uses a hierarchy approach, starting with less distressing situations, like I said, with the ladder, and progressively moving to more challenging ones. This is a step-by-step approach that helps individuals build confidence and tolerance. The therapist plays a crucial role in simply guiding the exposure process, providing support and safety. Exposure therapy is evidence-based and has been shown to be highly effective in treating various anxiety, trauma, and OCD-related disorders. It helps individuals confront and process their fears, reduce avoidant behaviors, and ultimately more fulfilling and less anxiety-ridden lives. The systematic desensitization is a therapeutic technique that's used in exposure therapy, and it helps individuals reduce their anxiety and fear responses to specific exposures, traumatic memories, or distressing situations. So let's see how that works now. So safety, once again, is essential to the process. The therapist and the client work together to create a fear hierarchy. So we create, how does that look? The hierarchy is simply a list of various situations or stimuli related to the individual's fears. So we're gonna start with those that provoke minimal anxiety and progressive up to the most anxiety-provoking ones, step by step. We want to get low-hanging fruit to start off with. These situations are divided into small, manageable steps. So before facing the feared stimuli, individuals are taught, bringing in that SE, relaxation techniques such as breathing, progressive muscle relaxation, mindfulness. These techniques help them reduce the physiological arousal and anxiety. The individual then could begin with the least provoking situation from their hierarchy. They're guided to imagine, feel, or directly experience the situation. While simultaneously, that's when I bring in the SE, practicing the relaxation techniques. Once the individual can face the first scenario with reduced anxiety, they move to the next step in a hierarchy. So this process is repeated with the client, gradually confronting progressively more anxiety-provoking situations. This gradual procession allows them to build confidence and tolerance over time. This structured approach also ensures that the exposure is controlled, predictable, and manageable, reducing the risk of overwhelming emotional responses. We want to do the least amount of harm in the therapeutic process, making sure they're safe, and that titration, that pendulation can happen using those techniques from SE. For individuals with traumatic experiencing, ensuring a safe and structured environment is essential. Trust is crucial for the therapy to be effective. The client must feel safe and supported throughout the exposure process. Gradual and symptomatic exposures maximizes the chances of success. Safety in the exposure process helps individuals resist avoidance and approach their fears, which is an important component of this treatment to be successful. Definitely works. Let me connect that back to our body. How does that work with the autonomic nervous system? The autonomic nervous system plays a crucial role in extinguishing the feared response through exposure therapy. So the autonomic nervous system is instrumental in this process. So when an individual encounters the feared stimulus or traumatic memory, your somatic nervous system, part of the automatic nervous system, becomes activated. Remember, this triggers the fight or flight response, characterized by the increased heart rate, faster beating, muscle tension, and the release of those stress hormones. This prepares your body to respond to perceived threats. Now, let's see the difference when you bring in exposure therapy. Exposure therapy employs a hierarchy and a systematic approach to confronting the feared stimulus. The hierarchy of feared situations is designed to start with least anxiety, increasing scenarios and progress to more distressing ones. So an individual, they are gradually exposed to the situation. Sounds familiar? We're doing that titration gently. And then the sympathetic nervous system response is triggered, but in a controlled and manageable way. So important for the therapist to be able to have that controlled environment. So then habituation is going to start going up. That habituation is a critical central process in exposure therapy. It's the reduction of the feared response over time as individuals repeatedly confront the feared stimulus. So the autonomic nervous system's role in this process is gradually reducing the intensity of the systematic response to the feared stimulus. As exposure therapy continues, the body becomes less and less reactive to the anxiety-provoking situation. Does that make sense? During this exposure process, individuals confront the fears. They often use relaxation techniques to activate that parasympathetic nervous system, such as breathing exercises, the mindfulness to orientation. The gradual and controlled exposure to the feared stimuli helps your autonomic nervous system learn that these situations are not threatening. As perceived over time, the body's feared responses makes a shift, and it begins to extinguish the sympathetic activation, decreasing that parasympathetic activation increases. So that break kicks in, relieving that gas. And as the autonomic nervous system regulates itself through exposure therapy, that emotional arousal, it decreases. It decreases. Then individuals become less anxious, less fearful, and less reactive to the stimulus. The reduction of the fear response during exposure therapy often generalizes to others' situations. So, okay, I'm afraid of being in a car accident. My body started to activate, started regulating itself. Something is happening with those spiders too. My body, it's complimenting. We're making that amygdala like, oh, amygdala, thank you for trying to keep me safe, but I'm okay. So when we get these different sensations, our body learns to respond. It's amazing. So give your body some appreciation right now for working so hard for you. Clients learn that they can confront these fears, manage their psychological response, and reduce their anxiety. I feel that in my body right now. Thank you. I feel that parasympathetic nervous system slowly putting on that brake. You're okay. You're okay. And this can lead to decreased fear response in a wider range of situations. Like I said, your autonomic nervous system plays a crucial role in extinguishing this fear during this exposure therapy, facilitating the process of habituation, that gradual reduction of sympathetic activation, and the promotion of our break, that parasympathetic relaxation. And through these physiological changes, you learn to adapt to fears, manage your anxiety, and ultimately reduce the stress. Allow yourself to breathe. Now, how is this going to look for us to combine this? Let's do this. Combining somatic experiencing and exposure therapy can be highly effective in addressing trauma, as it capitalizes on the strengths of each approach and addresses trauma from both a body and a cognitive approach. I love neuroscience. And one thing I learned, talk therapy, you're trying to using your prefrontal cortex to make sense of irrational things. But we get stuck because our brain, our prefrontal cortex, is the newest part of our brain. But if we go down to our limbic system and include our amygdala, which part of our oldest part of our brain, it remembers through our memories. It lives in our body, even in our subconscious. You consolidate and reconsolidate our memories. So it's trying to protect us. But by combining your body and your mind, then you can go ahead and get to that cognitive part once your amygdala's like, okay, we are safe here. Definitely we're safe here. This integrative approach can provide a more comprehensive and tailored treatment for individuals dealing with trauma. I'm getting excited. Here's how it works. So somatic experiencing focuses on the body's response to trauma, helping individuals become more aware of their body sensations and facilitating the release of stored tension. Then we're going to throw some exposure therapy.
The exposure therapy, on the other hand, addresses trauma-related thoughts and fears. So do you see how we brought all of that in? Combining these approaches, it literally provides a holistic perspective addressing the cognitive, emotional, and psychological aspects of trauma. We're going to combine everything. Both somatic experiencing and exposure therapy emphasizes on the importance of safety and trust. This foundation is crucial for any trauma therapy, ensuring that individuals feel secure and supported throughout the process. Somatic experiencing helps develop the body's awareness and supports the gradual desensitization to body sensations related to trauma. This body-oriented work can be integrated into exposure therapy, allowing individuals to still confront their fears while staying attuned to their bodily responses. We feel the entire body, your entire self, not just parts. It helps individuals tolerate and process trauma related to physical sensations during the exposure. SE encourages processing by allowing individuals to connect with their emotional responses to trauma, while exposure therapy component in the integrational approach helps individuals process their emotions by confronting the fears and traumatic memories in a controlled setting. Exposure therapy involves systematic, remember, and gradual exposure to the trauma-related triggers, providing that habituation where the feared response diminishes over time, and somatic experiencing contributes by helping the individual tolerate and accept the physical and emotional sensations accompanying exposure. Exposure therapy offers cognitive restructuring to address and reframe the trauma-related thoughts and beliefs. You see, we got that everything coming into our brain through our thalamus. Think of your thalamus as grand central station. All your 5 senses that's affecting the trauma. And then now using exposure therapy and somatic experiencing, we got our amygdala paying attention to what's happening with our body. And now we integrated our prefrontal cortex in our frontal lobes so we can use some cognitive approaches, combining them so they can complement the emotional and sensory processes with somatic experiencing, leading to a more comprehensive change on how individuals perceive and react to trauma. Yes, combining somatic experiencing and exposure therapy allows for a highly individualized approach. The therapist can then tailor the treatment plan to each person and the responses of the individual. This flexibility is essential because trauma experiences and reactions vary from person to person. No one has the same experience. SE emphasizes the identification of internal and external resources to support the individual in managing trauma-related symptoms. These resources can be incorporated into exposure therapy to provide a sense of safety and support during the exposure process. Number one goal is always to make sure we have our clients safe and stabilized. Safe and stabilized. So this integrative approach typically involves that gradual progression through the therapeutic process, with exposure becoming more pronounced as individuals develop a greater tolerance for confronting their traumatic material. And by addressing trauma from multiple angles, the combined somatic experiencing and exposure therapy can promote substantial recovery. Individuals can experience not only systematic reduction, but also increased resilience and ability to manage their trauma response in the long run. This integration of somatic experiencing and exposure therapy has shown promising outcomes in helping individuals with trauma-related issues. While there may not be an extensive study specifically focusing on combining both of these approaches, there have been case reports and clinical anecdotes that highlight its effectiveness. Don't just hold on, because I am working on creating more of these studies. Give me time. So we're going to make it happen. There's a case study, PTSD in combat veterans, case study. It was published in the Journal of Clinical Psychology, and it presented a combat vet with PTSD. The veteran underwent a treatment plan that combined the elements of somatic experience and exposure therapy. The integration of the somatic experience techniques to regulate the autonomic nervous system and facilitate emotional processing, along with the gradual exposure, resulted in significant reduction in his post-traumatic stress symptoms, including his intrusive thoughts, his hypervigilance. And the case demonstrated the potential benefits of combining these two approaches to address complex trauma. In a clinical setting, therapists have reported positive outcomes when integrating somatic experiencing and exposure therapy in treatment of individuals with a history of childhood abuse, physical and sexual. I personally integrate them in my private practice. It's getting to the point I don't know how to do one without the other now. The combo has allowed me to have a more holistic approach to healing and addressing both the physical and the emotional aspects of trauma. My clients have reported a reduced in anxiety, improved regulation, and greater ability to confront their traumatic events. Many mental health practitioners have also incorporated SE and ET into their private practice to address traumatic events. Some qualitative research has explored therapists and their perspective on integrating SE and ET. Therapists have reported that the combined therapies provide a more comprehensive approach to therapy, addressing a wide range of trauma-related symptoms. Clients have benefited from the enhanced emotional processing, greater body awareness, and symptom reduction, accomplishing this through this integrative approach. While there may not be a large scale of randomized controlled trials, hint, hint, that's an invite to everyone, specifically involving investigating combined use of somatic experiencing and exposure therapy. These case reports and these studies have provided a valuable insight into the potential benefits of integrating therapeutic approaches. Combining SE and ET appears to offer a more holistic and individualized way to address trauma-related issues, with a focus on both the body and the mind, leading to positive results. So let's go over recap. This webinar covered the healing effects of trauma using SE and ET with a focus on the role of the autonomic nervous system in trauma recovery. Trauma can take various forms, including, we said, physical, emotional, psychological. It leads to dysregulation of the autonomic nervous system, and that plays a vital role in regulating our bodily functions. It has two divisions: the sympathetic for that fight and flight nervous system, and the parasympathetic, the rest and digest. Dysregulation of the autonomic nervous system is a combined feature of trauma. And SE is a therapeutic approach developed by Dr. Peter Levine, focused on the body's role in trauma recovery. It addresses trauma through the felt sense, the soul nerve, as Resma says, and gradual exploration of body sensations. The key principles include titration, pendulation, and the completion of the survival response. We want to end it. Exposure therapy involves gradual confrontation of trauma-related triggers. It promotes habituation, emotional processing, and desensitization through systematic controlled exposure. Integrating somatic experience and exposure therapy offers a holistic approach to trauma treatment. SE focuses body awareness, emotional processing, while exposure therapy systematically addresses trauma-related thoughts and fears. This combined approach can help adapt to trauma gradually. With that being said, thank you so much for your time. And please, let's see if anything came up, if there's any questions, any thoughts, feelings, reactions. It has been my honor. And we'll also provide some resources for you.
So if we can, let's unmute and come on screen and give Sharlisa an incredible hand. This is a really big, a wonderful endeavor. We know that right now, the exposure therapy is one of the gold standards of trauma treatment, but it misses core parts of embodiment. So being able to do that academic and clinical work of bringing these two together could actually bridge a field in a profound way. So I want to thank Sharlisa for her leadership, her academic scholarship, her intellect, and her clinical skill that she brought to this. And want to just leave it open for questions. Sharlisa, do you want people to raise their hands? Want people to just come on?
And
What would feel
please
good to you?
jump in, what comes up in your body, please.
Beautiful. So just feel free to unmute and ask questions. And thank you again, Sharlisa. We'll do a little close before we go, but would love to hear some questions. And just a reminder, I know sometimes in academia, people make statements rather than questions, but see if you can do your best to ask her a question, honor her in that way.
And if there's no questions, please feel free. I invite you to just simply notice what's happening in your body now. Just notice what comes up. Send your curiosity there without any judgments. Just simply notice. Allowing ourselves to just be in a space together. Just sharing energy.
So I have a quick question.
Yes.
What do you set up your therapy by creating like the hierarchy with the client at the beginning? And then do you kind of do pendulation around each one of the things, allowing for
Yes.
emotion? Well, I'd love to hear your, sorry.
Yeah, so when I start, I usually always start with body work. So I'm starting with SE, just so I can see their level of insight relating. So lots of resourcing. So I start with the resourcing and providing them with that safety and stabilization. And then I let them know exposure therapy is hard. It's very hard. So I prepare them for that, but I make sure they have the toys so they can play with before we get started. So then we start creating that hierarchy so that they can have that level of support. Then we start with that low-hanging fruit. That way they know it actually works. And I'm not re-traumatizing them. I want them to come back. And I let them know, I want you to, heal. I want to be put out of business. I want to be out of a job. So that's my job, to get that healing process happening as soon as possible. And I let them know, a lot of people are so used to doing talk therapy. And I always start off and let them know I do bottom up therapy. We have to bring that in your body. And that's also how we're going to create your hierarchy. Does that make sense?
I think what I'd like to say is not so much a question, but that having clients come to me in my somatic experiencing practice to be able to integrate their exposure therapy, that I really appreciate that you are bringing this, integrating this into all the therapists' practices that are doing it, and that it's interwoven and from the beginning, and what a difference that can make. And I'm just so appreciative of your attunement to that. So thank you. Yeah. I'd rather not do mop up, but be working with other ways of being with folks and not having to do that with them after the fact.
I have one more minor question. I have a feeling that you probably have a clear answer for this. One of the ideas, the challenges with exposure therapy is that it has a higher dropout rate. At least that's one of the critiques. I haven't really examined the literature in enough detail to know that in my bones. But do you think that this is something that that could address that dropout rate through kind of growing resource and gaining some of the tolerance in a more titrated, more SE way?
Definitely, definitely. When I first was trained in exposure therapy, I was like, whoa, there's no way I would want to stay like this. And I was like, it was hard. And it went against all of my SE training. So I'm like, okay, how do I repair this? Because I know it works, but I don't want to create a new trauma for my clients to come doing the exposure therapy. So I'm like, I have to bring in that body work. You have to. You can't just, I'm terrified of being in a car accident and I'm going to just expose you to car accidents without any tools. You have to have that resourcing. You have to have that body work done. And when my clients come, they're like, thank you. I've tried so many other therapists who just did the exposure therapy and I was terrified and it was too much. I couldn't sit in there. And I'm like, we're going to do this resourcing. We're going to give you the tools so you can sit in that, so your body can sit in this with you. I don't want to just expose you to Michael Myers for hours and hours and then you're numb. What's happening with that parasympathetic nervous system? That's when we're entering that dorsal vagal area. Now I need to make sure that I'm gently providing that titration and that pendulation and that it's healing completely within your entire body, not numbing it. So does that make sense?
That's a very inspiring answer. Thank you. I want to leave space for others, but I have 1,000 questions.
I just really want to appreciate your passion for this work and for, yeah, it's just like you light up a Zoom room. And you're just obvious care and concern for your clients and for all of our clients in healing. Just really want to appreciate you for that.
And we have time for maybe one more question before we thank our speaker today. Anybody feels so drawn or comment, please feel free to comment as well. All right. Well, I'm so grateful, Sharlisa, for your time, your energy, and your skill. And I'm going to pass back to our president, Maureen. And thank you, Cindy, for that lovely comment. I'm pass back to our president, Maureen Harrington, for just a few closing words. You're muted.
Oh, I see we did have a question in the chat.
Oh,
Please respond. You have
How
time.
differs by age range, specifically with children? Huge difference. With that, when working with children, we create accommodations. We make sure we involve the parent, because usually we all want the best for our children. And by having 6 amazing daughters and now 2.5 granddaughters, being able to sit with that, it's so, it's much more complicated, and you have to pull the parent and be like, I understand that you want to support your kiddo, but we have to make sure that you understand we're not reassuring. So no reassuring. So I provide an extra accommodation step for the parents and work with the parents on creating healthy boundaries, because it's hard. Your kid's like, well, I can't go over 3 cracks when I'm walking to school. I have to skip over one. I have to do that. And we're like, no, we're not gonna invite our OCD is not welcome here today. We're not gonna have it come today. And that's hard. So actually, fur babies are always welcome. Always bringing that extra step accommodation for parents in, if that makes sense to answer that question. Thank you so much. One of my amazing students, one of our future therapists, is going to do amazing work.
Yeah, and I think
Right.
it's such a beautiful question, and bringing the family in is such an important thing. And thank you for that, Sharlisa, and really helping the family be an agent of healing. It's important to me. And I think we probably are at closing time, so I'm going to pass back to
Yeah.
Maureen. And I'm just so grateful, Sharlisa, for your skill and sharing your time with us.
So again, just thanking you, Sharlisa. And if people would like to connect with you and support your work, you can leave your number in the chat or however you'd like to be contacted, if you would. And I just know I'm feeling inspired and touched by your work. And yeah, just thanks for your time and sharing this with us. So I'd like to just open a round of applause for this wonderful presentation. And then again, as a reminder, we're going to have our next event, speaker event on December 5th at 12 noon. And that will be the title will be Working with Complex PTSD, Developmental Wounds in Individual Therapy. And that will be with another Bay Area member, Christine Donahue. So please, again, welcoming you into membership for NorCal SEPA. Check out our website and consider serving on our board or committees and help us lead the way for our Northern California SE community. And see you at the next event. Thanks for coming and sharing your afternoon with us.
Thank you.
Woo-hoo. Thank you, everybody.
Bye-bye.